Cipaglucosidase alpha, also known as ATGA 105 mg intravenous solution, is used in combination with miglustat to treat Pompe disease, a certain inherited condition. This medication works by breaking down a substance called glycogen that builds up in the body due to Pompe disease. By decreasing glycogen levels, this medication can help improve symptoms such as muscle weakness, heart problems, and breathing problems. It is important to use this medication with miglustat as it helps cipaglucosidase alpha stay active in the blood, which ultimately helps it work better. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. This medication is usually given once every other week, 1 hour after you take miglustat. It is injected slowly into a vein, usually over 4 hours, by a healthcare professional. The dosage is based on your medical condition, weight, and how you respond to the treatment. It's important to use this medication regularly to get the most benefit from it. You can mark the days on the calendar when you need to receive the medication to help you remember. If you miss your dose of miglustat or your infusion is not started within 3 hours of taking miglustat, your infusion will need to be rescheduled. Make sure to ask your doctor or pharmacist right away for a new dosing schedule. Remember to tell your doctor if your condition does not improve or if it gets worse. If you experience headache, diarrhea, or dizziness while using Cipaglucosidase Alfa-Atga 105 mg intravenous solution, it's important to inform your doctor or pharmacist. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. It's important to note that this is not a complete list of potential side effects. If you notice any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice, or report any side effects to Health Canada. If you are receiving cipaglucosidase alpha, you may experience infusion reactions or serious allergic reactions. Your doctor may prescribe other medications to help decrease these side effects, such as a fever reducer, antihistamines, or corticosteroids. It is important to carefully follow your doctor's directions for all of your medications. If you notice any signs of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, trouble breathing, chills, or flushing, seek medical help right away. Your infusion may be slowed down or stopped depending on your symptoms. Before starting treatment with this medication, inform your doctor if you have a history of heart problems, breathing problems, or swelling, as these issues may worsen during the infusion. Your doctor or nurse may monitor you for longer periods after your infusion. Before using cipaglucosidase alpha, it's important to let your doctor or pharmacist know if you have any allergies to this medication or any other substances. This is because cipaglucosidase alpha may contain inactive ingredients that could cause allergic reactions or other issues. It's also important to let your doctor or pharmacist know about your medical history before using this medication. This drug may cause dizziness, especially when combined with alcohol or marijuana, cannabis. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. It's also recommended to limit alcoholic beverages and speak to your doctor if you are using marijuana, cannabis. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are using cipaglucosidase alpha in combination with miglustat, it's important to not use this medication during pregnancy, as it may harm an unborn baby. Your doctor should order a pregnancy test before you start this medication, and it's important to discuss the use of reliable forms of birth control while using this medication and for at least 60 days after the last dose. If you become pregnant or think you may be pregnant, it's important to inform your doctor right away. It is currently unknown if this medication passes into breast milk, and because of the possible risk to the infant, breastfeeding is not recommended while using this medication. It's best to consult your doctor before breastfeeding. When taking cipaglucosidase Alfa-Atga 105 mg intravenous solution, it is important to be aware of potential drug interactions that may affect how this medication works or increase the risk of serious side effects. It is essential to keep a comprehensive list of all products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It is crucial not to start, stop, or change the dosage of any medicines without the approval and guidance of your doctor. This will help ensure the safe and effective use of Cipaglucosidase Alfa-Atga 105 mg intravenous solution. As always, consult with your healthcare provider for personalized advice and recommendations. If someone has taken too much of Cipaglucosidase Alfa-Atga 105 mg intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. It's important to act quickly in these situations to ensure the best possible outcome. Make sure to attend all of your scheduled medical appointments and laboratory tests while using Cipaglucosidase Alfa-Atga 105 mg intravenous solution. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. Make sure to follow the dosing schedule for Cipaglucosidase Alfa-Atga 105 mg intravenous solution as prescribed by your doctor. If you happen to miss a dose, it's important to consult with your doctor or pharmacist for a new dosing schedule. This medication, Cipaglucosidase Alfa-Atga 105 mg intravenous solution, is typically administered in a hospital, clinic, or doctor's office and is not meant to be stored at home. It is used to treat people with Pompe disease, a rare genetic disorder that causes muscle weakness and affects the heart and other organs. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific needs and medical condition. It is important to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.